information coming in that I thought would be relevant today, and I'll get to it shortly. I do want to thank y'all for joining us again. I want to thank all the people across the state for tuning in, whether it's by TV or by radio. We're obviously back in Baton Rouge today after spending yesterday in North Louisiana in the Monroe area touring storm damage in West Monroe and in Monroe, and we're going to keep you updated on that situation as well. Today, in addition to Dr. Alex Bu, I'm also joined by Secretary Jim LeBlanc of the Department of Corrections. He's going to be here in order to address you and take questions about an announcement we're making today regarding the potential furlough of some nonviolent, non-sex offenders who are within 6 months of their release date. First, I did want to talk about today's numbers. Unfortunately, we hit another very grim milestone that I'll get to in just a moment. Today, we're reporting 502 new cases of COVID-19 in Louisiana, and that brings us to a total of 21,518 confirmed cases. The death count has increased by 129, and that is the largest number of deaths that we've reported in a 24-hour period since this started. And not only is that the largest number, it brought us over 1,000 deaths total to 1,013. The top three parishes for today's deaths: Orleans with 32, Jefferson with 24, Caddo with 17. And I hope the gravity of this resonates with everyone out there, because we're not just talking about the number 1,013 or today's number 129. Every one of these numbers is a person. It's one of our neighbors. It's one of our friends. It's somebody's parent, somebody's child, and so I don't want that to be lost on anyone. These are our fellow Louisianans. We grieve for them alongside their families, and of course, I'm asking people to lift all these families up in prayer. We've been saying for a period of time that even though we report deaths every day, not every death that we reported happened in the previous 24 hours. That's certainly the case with these. And in fact, our analysis, it appears that only 21 of the 129 deaths that we're reporting today actually occurred in the previous 24-hour period. Our analysis further shows that on average, death comes 11.2 days after the onset of symptoms for those individuals who do succumb to this disease. And that's why we're continually looking at the data and trying to figure out what the trends actually are. 72 of the 129 occurred in the last 3 days. So it remains very important for everyone to follow the stay-at-home order, because just as compliance with the stay-at-home order and social distancing and proper hygiene will save lives, because fewer people will contract the disease and fewer people will be in that daily count that we just talked about, it is also true that the failure to do these things will mean that more people are exposed to the virus, many of whom will contract the disease, and a certain percentage of those who contract the disease are going to get ill, go to the hospital, some will die, and then many of those are going to continue to transmit it. So what we have to do is focus on the things that we've been talking about for literally weeks now, and that is following the stay-at-home order, be patient, practice social distancing, practice good hygiene, minimize your contact with people, absolutely stay home if you are sick, those sorts of things. Now, while that number of 129 deaths is very troublesome, there are some positive signs in today's numbers as well. They do show a drop in the hospitalizations of people with COVID-19 and a reduction in ventilator utilization of people with COVID-19. We also have some new testing sites to talk about for people who need to be tested because they have COVID-19 symptoms. And I remind folks that the tests that we're administering, they are not reliable for individuals who don't yet have symptoms. And so those are the individuals that will be tested. But in St. Charles Parish, beginning tomorrow, Wednesday, April the 15th, there will be testing at Hanville High School in Butte, and that will be in the morning starting at 8 o'clock, and they will run until noon or until they reach a capacity of 250 tests. In St. James Parish, we will have testing at Gramercy Elementary School. They'll have a soft opening for the first responders and senior citizens over the age of 65, and then they will be open daily from 8 a.m. Starting on Thursday for people over the age of 18. You will have to be in line by noon in order to be tested at Gramercy Elementary School. Starting tomorrow, GoSep will provide tests for the Alario Center testing. Currently, it's a FEMA pilot program. FEMA and the Department of Health and Human Services from the federal government sponsored these sites. These were the first, three of the first sites in the country. Two of them were in Orleans Parish. One was in Jefferson, and in Jefferson it's been at the Alario Center. So they are withdrawing the federal support, but we're going to continue to administer the testing at the Alario Center. It's just going to be administered by GoSep. So it's going to become a state operated and funded testing site starting tomorrow. And so the drive that should be pretty much a non-event for the individuals because it's going to continue to function just as it has. COVID-19 testing will be available at the Alario Center to any individual 18 years or older with symptoms, and they're going to continue to test up to 250 per day, and it opens at 8 a.m., 7 days a week. Today's test count, and this was also the largest number of tests that we've ever reported in a 24-hour period, but it's 10,331 tests. That brings us to a total of 118,422 tests, which, according to all of the publicly available data on testing across the country, Louisiana is number one per capita for the tests that have been administered. I do want to thank Sasol for contributing $100,000 to coronal relief efforts. They're supporting our frontline emergency responders, healthcare professionals, educators, food service providers. Through the Community Foundation of Southwest Louisiana Fund, Sasol employs more than 1,200 people in that community, and that's a very generous donation. We really do appreciate it. We have a few other important announcements. One is the Paycheck Protection Program that's being administered through the Small Business Administration. Just reported, this is what I was talking about before I walked out, 17,097 loans have been made, approved in Louisiana through that program, a little more than $3.7 billion for Louisiana businesses. Also, we're announcing efforts to reduce the spread of COVID-19 in prisons by granting a temporary furlough to some nonviolent, non-sex offenders who are within 6 months of release. So they're in the last 6 months of their prison sentence. These efforts mirror the same actions being taken at the federal level based on the order of U.S. Attorney General William Barr. And he's done that through the Bureau of Prisons. As I mentioned earlier, Secretary LeBlanc will speak more on this topic in just a moment. Today, I also signed a proclamation moving Louisiana's elections back several weeks at the request of Secretary of State Kyle Ardoin. The June 20th, 2020 presidential preference primary election in Louisiana will be rescheduled for July 11th from 7 a.m. to 8 p.m. The July 25th 2020 election is hereby rescheduled for August the 15th from 7 a.m. to 8 p.m. And the Secretary of State is presently developing a plan for how to move forward with the election. He's going to present that to the legislature tomorrow. Both the House and Senate Government Affairs Committee will meet at the state capitol tomorrow to consider his plan. Now, as I close with my prepared remarks, and I'll come back up in just a moment to answer a couple questions for some citizens and then answer your questions. We're still very much in the middle of the efforts to flatten the curve and see that curve actually start to trend downward, which is incredibly important. And we're reporting, and everybody is seeing some of these favorable numbers. Now, we know that today's death count is serious, the largest ever, but as I mentioned before, that's a lagging indicator. If you look at the number of tests that were informing our information today, and that being the highest ever, and the case count, obviously it's troublesome to have 502 new cases, but that's not anywhere close to the highest number that we've had. And when you especially look at hospitalizations and ventilator usage, so we're seeing some positive trends. But the reason we're seeing the trends, and this is what sometimes gets lost on people, is because of the mitigation measures. It's because of the stay-at-home order. It is because of social distancing. It is because of hygiene. It's because sick people are staying home. Doing all of those things. Because had it not been for those things, we would have seen the modeling come true that we were talking about a month ago. Very, very troublesome, because you can remember we started off having the quickest growth in cases in the world right here in Louisiana. We're in a much better place. It's because of what we've done. And if we stop doing those things too soon, we know we're going to see a spike again. And we're going to get right back to where we don't want to be. Because I am so pleased to tell you there is not a single region of our state where, as far out as we can accurately model, that we see that we're going to overwhelm our capacity to deliver health care today. So within the next couple of weeks, that's not going to happen. But it can easily happen if people resume their normal activities. They stop, following the hygiene guidelines that we've put out. They stop following the social distancing guidelines, and they stop complying with the stay-at-home order. So we've got to continue to message that. The decisions that we make today collectively, what people do, they're going to have either a positive impact on our state or a negative impact. And the truth is, we're not going to know for a week, 10 days, 11 days, something like that. So let's just consider that. And just understand that what it means to be a good neighbor today is very different than what it was before the novel coronavirus came to our state and started spreading this nasty disease of COVID-19. And think about not just yourself and your family, but all the other individuals and their families who are out there as well. Think about those 1,013 deaths that we're reporting in Louisiana. It's just a very tragic situation, and it's not going to be over tomorrow. It's not going to be over next week, but we can make sure that when it is over, that it will not have been the worst possible case scenario that it could have been otherwise. Now I'm going to turn the podium over to Secretary LeBlanc, and he's going to talk more about the program I just mentioned, and then I'll come back and take some questions from the public and then your questions.
Thank you, Governor. Good afternoon, everybody. The COVID pandemic has had an unprecedented impact on the state of Louisiana, including those committed to working and those committed to our prisons that spend time in our jails and prisons. We have created the COVID-19 Furlough Review Panel to evaluate certain nonviolent, non-sex offenders for suitability pursuant to the state law which authorizes DOC to grant temporary furlough to inmates within their last 6 months of prison sentence. These efforts mirror the same actions as the governor mentioned taken by the federal level based on the order of U.S. Attorney William Bohr. Public safety obviously is paramount to anything that we do when you make decisions of furloughing any inmate, which is why we have chosen to create a review process that involves multiple stakeholders. This review panel will be comprised of myself or designee, Director of Probation and Parole or designee, Executive Director of the Pardon and Parole Board, Victims Advocate appointed by the Governor, Executive Director of the Louisiana Sheriff's Association or designee, Executive Director of the District Attorneys Association or designee. To be considered suitable, a vote of 5 out of 6 panel members is required. The panel will review inmates on a rolling case-by-case basis until the governor ends the Louisiana public health emergency. Conditions of the furlough require home incarceration with ankle monitors and active supervision for the duration of the furlough. The individual furlough can be canceled at any time during this event if a violation occurs. The panel is tasked with reviewing 2 separate groups of DOC inmates for the purposes of release. Group 1 includes inmates currently housed in state prisons with pre-existing medical conditions who meet the following criteria: serving sentences for nonviolent, non-sex offenses, or within 6 months of their release, and important to note, they must have housing or residence plan ready to receive them. Group 2 includes inmates who are mostly housed in local jails and meet the following criteria: serving sentences for nonviolent, non-sex offenses, or within 6 months of their release date and have served at least 6 months, having house or a residence plan ready to receive them. So that's the basis of it. We do have a press release. I think it's out there. And in the press release, you'll see a little bit more detail about the things that we're doing. I think it's important for me to note, and I hope the governor will permit me to use this opportunity to thank the staff in our department, the work they're doing in response to this pandemic. Like our community health care workers, those working for the Department of Corrections are all considered essential staff, essential to providing public safety for this state. Their commitment to reporting to work and providing for the safety and security of our prisons in our community is commendable. Prison staff are committed to both ensuring security and providing health care to those in our facilities. Probation and parole staff are continuing to provide community supervision and filling non-traditional roles of supporting the state's response. They are some of the heroes of our response in this state. So with that, I'll take any questions you might have. Yes, sir.
Yeah, how many prisoners do we think are going to qualify for this, given it looks pretty narrowly tailored?
It is. On Group 1, it's approximately 100 with medical conditions. Group 2 is around 1,100. Yes, ma'am.
The department had a lawsuit filed against it in federal court today involving a plan to move COVID-positive patients to Camp J at Angola. Can you talk a little bit more about the decision-making involving Camp J, and if you can respond to anything involving
Well, being a lawsuit, it's difficult to say a whole lot other than the fact that if you look at our response to the injunction that was filed, I think that pretty much covers the basis of how we feel about what we did at Camp J. I think it was the right move on our part for the department. Obviously, I wouldn't have done it. And it's a safe haven for those that are there, honestly.
How many people have been moved to Camp J at this point?
The number's around 46.
And they're from both state prisons and also local?
No, ma'am. They're local level, and only Angola houses their positives there. Everything else is housed at the state facility where they're in other words, Hunt. Everybody's doing their own isolating and quarantine.
Is the reason behind this to reduce the population and lower the spread or the chance of spread of corona? I mean, what's the idea behind it?
It's to create room, in that sense, and I think that's the main thing, is to create room at the local level, and obviously, especially on the medical end, if we can get people out of harm's way, that certainly is a plus too. And I think it's a way of mitigating the potential for a future spread.
Was the review panel a recommendation from the feds or Attorney General Barr, or was it just something you guys decided was appropriate?
No, it's actually, the statute allows me to do it, but I thought it was in our best interest and everybody's best interest, and along with the decision with the governor, that creating a panel was the best thing to do, and getting everyone involved in the process, as we have done for pretrials at the local level. We're working with the judges, the DAs, the sheriffs, and all those involved in the criminal justice system to do the right thing at the local level, and we've already done quite a bit. This is just an extension of what we've already done.
When will the reviews begin?
Friday. Friday's our first review, all done on Zoom, drop boxes, all electronically.
And how many a day will you go through? You think?
Well, we're starting the first panel to schedule 40 in the first day, and we'll see how that goes to determine. That'll give us an idea of what we can do. Probably meeting 2 to 3 times a week. You know, and that you know, we'll do that every week. I mean, for whatever time it takes. Yeah.
Yes, I mean, this may not be the main reason to do these furloughs, but is there a financial discussion as well? I mean, the state government has been spending quite a bit, rightfully so, on a lot of these measures. But
No, honestly, I haven't looked at that, but it certainly, I'm sure it will be some advantage on the funding side of it, but that's not the reason behind this, not at all. Thank you.
Thank you, Jimmy.
Yes,
Jimmy, if you want, you can
Yes, sir.
go back to work. Appreciate you, Jimmy. Okay, today's first question comes from Shreveport, and Matthew asks, is there any way we can volunteer directly in the effort to stop the spread of COVID-19? Well, it's not technically volunteering, I guess, if it's an order, but you can follow the stay-at-home order. That's very, very helpful to stop the spread of COVID-19. And as we mentioned, practice social distancing of at least 6 feet between yourself and others. Practicing good hygiene, including washing your hands for 20 seconds with soap and water. Using hand sanitizer when you can't get to soap and water. Staying home when you're sick. And when you're out in public and going to be in close proximity to others, it's now a CDC recommendation that you wear a mask. And so you can do those things. Check on your family and friends by calling them. You can use Zoom and FaceTime and Skype and other alternatives. Encourage them to do the same. I'm also asking folks to, if they are able to do so, to consider making a financial contribution to the local food bank. This crisis has caused a lot of people to access food banks for the first time. And so the demand being placed on the food banks is something they're not accustomed to. And a little bit of money really goes a long way in our food banks and being able to feed people. Obviously, nutrition is important all the time. It's certainly important now when we want people to be as healthy as possible and have strong immune systems. $1 will provide 4 meals. So just keep that in mind. And so I'd ask you to visit feedinglouisiana.org. So that's feedinglouisiana.org for more information. And there are obviously a lot of other charitable organizations who are doing really good work across Louisiana. You can find out more by visiting coronavirus.la.gov. Olivia from Lafayette asks, how is the virus different than the seasonal flu? And why shouldn't we compare the number of deaths yearly from the flu to COVID-19? I think there are some comparisons and contrasts being made with respect to the flu. There are obviously some similarities. The flu is itself a coronavirus, right?
It's a different virus, influenza virus.
It's an influenza virus. I'm sorry. The similarities are that they are viruses. There are obviously some real differences, however, and the differences are the fact that the novel coronavirus is much more easily spread. It's much more contagious than the flu. For example, the transmission rate of the flu is typically about 1.3 people. For COVID, a single infected person would be expected to infect about 2.5 people. So twice as contagious. The average number of people who need to be hospitalized with the flu is about 2%, whereas if you catch a COVID-19, if you contract that disease, it's 19 to 20% are going to require hospitalization. And the fatality rate for the flu is 0.1%. But for COVID, as best we can tell, it is somewhere between 1% and 3.4%. So obviously some real differences as well, although some of the symptoms are the same. Fever, cough, chills, shortness of breath, and so forth. So there are obviously some similarities as well, but we're asking anyone who is symptomatic, make sure you're contacting your health care provider. And if you're symptomatic, get tested as best you can. You can call 211 if you need information about testing, the testing protocol and that sort of thing. Tomorrow, our press conference is going to be at 4 p.m. because I have the monthly radio show that I will do tomorrow at 2. And tomorrow, I plan to be joined by Beth Ciano, Acting Superintendent of Education, to discuss the situation relative to K through 12 schools and the rest of the year. So with that, I will take your questions, and Dr. BU is here as well. Leo, I'm going to start with you in the back of the room.
Thank you. I'm seeing markedly more traffic on the streets of Baton Rouge. People are getting back out despite the warnings. And when you look at the number of tests that have been done, about 110, 112,000, I think you said, and you look at the number of people who have come back testing positive, it's about 1 in 5. It works out to about 19.5%. Is there any mechanism in place for when people might return based on the fact that they've been cleared by the tests?
Yeah. First of all, to address the first point you just made, obviously I'm not out and about every day, but I did fly to and from North Louisiana yesterday over some of our major highways. I did see more traffic than, quite frankly, I expected to see or wanted to see. And what your observation is consistent with what I'm being told by other people. For example, when they come to work here at GOSEP, they're seeing more traffic every day than they were seeing before. And we also have some social distancing apps now that are kind of assigning letter grades. And we weren't doing particularly well to begin with. I think our state was graded at a C or a C minus. I believe we moved down to a D most recently because they're using the GPS data in people's phones to kind of measure what the movement is. And that's why I'm trying to make sure that people understand that COVID-19 remains in every community. It is obviously fatal for a number of people. We're reporting on these deaths. People are contracting this disease and continue to spread this disease. And so it's important that people follow all of the precautions that we've been giving them, whether it's the order to stay at home, whether it's the hygiene, the social distancing, all of those things. It's incredibly important. I will tell you this. If you look at the efforts that have been made in Louisiana to increase our testing, they have been tremendously successful in the sense that we are administering more tests per capita than any other state in the nation. Very helpful. The worst thing you want to do is not know what you're dealing with. And now we can say that we have testing in every single region of the state. Every parish of the state has testing available. But we're not satisfied. We're trying to expand on the testing that's available for surveillance purposes, for diagnostic purposes, and for detecting the presence of the antibodies through serology tests. Now, these things are coming online now, and we have to make sure that they're approved and that they're effective and reliable and so forth. But I will tell you, the key to moving forward, especially between now and such time as a vaccine becomes available, will be through very aggressive, robust testing in all three of the categories that I just mentioned, plus contact tracing, so that when we get back to where we can remove some of these restrictions and start to open up our economy, you're going to see a lot more testing, and the test results will inform our decisions, and not just about who can potentially go to work and so forth, but as we start seeing, if we start seeing a spike in testing, we may have to ratchet back down and put in place more restrictions too. And so what we don't want to do is go right back to that place where we've been trying to avoid. And so testing plays a big role in all of this. It's a big part of Dr. BU's day, is coordinating the testing around the state, but also looking to private sector testing capacity and working with our federal partners to maximize the tests that are available here. Because while I salute him and I thank him and his team for their good work, and really you should know that over 90% of the tests that are coming in every day now are coming from commercial labs. And so we have healthcare providers. These hospitals are really stepping up. These FQHCs are really stepping up. The GOSEP here is going to start running the drive-through testing at the Ilario Center and so forth. We have Walmart with drive-up testing now. All of it is incredibly important as we move forward, and we're going to continue to bring more testing online and not less testing. And I don't know if you wanted to add anything to that, but that really is going to be key to us going forward. And I think you hear Dr. Fauci say this quite often as well. Yes, sir.